Hi, I'm Rosie, and I had a stigmatising experience in a healthcare setting a few years ago. So I was assessed by the crisis team, was feeling really suicidal and having suicidal urges. I didn't want to act on them because of how I knew it would make my family feel, but I really wanted to act on them. So I was referred to the crisis team by my university counsellor. They made me feel really invalidated, like they didn't listen to me. And they basically made me feel like I'd done the wrong thing and I was wasting their time, and I shouldn't have been there. So it was really, it really negatively impacted me, and I don't think I would seek help from them in the future because of that experience.
Hi, I'm Jess. So I've had a really similar experience to you. So I've got a diagnosis of borderline personality disorder, a long time OCD and bulimia, but my borderline personality disorder diagnosis is the most stigmatised. And I've experienced stigma and discrimination from mental health professionals in the crisis team and in inpatient settings. They completely invalidated me as well, and they made me feel like I didn't really want to ask them for help. They made me feel that I wasn't really worthy of asking for help. They told me they didn't believe that I was suicidal. They called me manipulative and dramatic and attention seeking, and even though I've also had some good experiences where small acts of kindness have really helped, those bad experiences outweigh those good ones.
Well, I'm Mark, and I've had many moons ago, it feels like, a negative experience within a healthcare setting with a GP, and I decided to take that plunge and basically go and tell them that something wasn't quite right. I went in, there was the doctor there, and she was kind of writing and head down. I kind of said, I can't see you, I don't quite feel myself, I'm not right. Still didn't lift up. And I said, yeah, I'm not right. And she turned to me, and I will forever remember her looking at me and saying, oh, well, you look all right. I was clinically diagnosed with clinical severe depression and anxiety. And then as soon as the label goes on, it's like, oh, right, okay, everyone else seems to be doing all right, but I obviously can't hack it. And then all the problems that you had going into the room are suddenly amplified.
My experiences, I think, caused me great psychological harm and trauma. They really stayed with me. They made me not want to ask for help the next time I needed help, and all of the times after that. Because they labelled me as a borderline patient, I think that made me act in a certain way. I acted as they would expect me to, and that just then added to their beliefs that I wasn't worthy for help.
Yeah, I feel the same, that like you were saying, you were only in there 20 minutes, but it had such a negative impact, and I feel the same, you know, it was half an hour of my life, but it had such a negative impact, and it kind of outweighed all the, as you were saying, all of the positive experiences and the amazing work that healthcare professionals have done to help me. You know, I feel sorry for them because that was completely outweighed by, you know, these really like insensitive comments.
I was made to feel a bit silly, especially as a male as well. You kind of have that kind of stigma before you've even gone in the room, because, you know, you've got to man up. It did damage for a long time, and probably impacted me way beyond that 20 minutes I was in that office.
The things for me that made the biggest difference, and that always make the biggest difference, are the small acts of kindness. I always think of the professionals and the individuals who afforded me the highest form of human knowledge, which to me is empathy. It's the cup of tea when they can see that I'm really struggling. It's offering a hug, maybe not in COVID, but in non-COVID times. It's offering me a space to listen without judgment. I think it's offering a space to listen without the need to reply or the need to problem solve, but just with wanting to understand what it is that's troubling me, and just being kind in that approach. That's kind of all I want when I'm in crisis, when I'm in distress, when I'm really poorly. I just want someone to be kind. I don't want them to fix things. I want them to help me fix things.
Really relate to that. I mean, what I wanted was, I have two experiences of being assessed by the crisis team, and one of them was fantastic and one of them was so detrimental. And the one that was really positive, the nurse sat kind of alongside me, and we put my suicidality out there as a problem to solve together. Yeah. And then, you know, when there was a really negative experience, it was two people sat kind of interviewing me. I felt like a suspect. I felt like I was in a police interview, and I felt like they were deciding whether I was telling the truth and whether I was serious enough about what I was talking about. So I just wish that somebody had asked me why I want to live rather than why I want to die. And I think that that would have really changed how that went. And also just spoken to me as if they cared whether I died or not.
I needed help. I trusted them for help. And I would just want them to treat me as a human and treat me the same way. And it's the most cliched saying, but just treat me how they'd want to be treated.
I became a Time to Change Wales champion because it was really important to me that other people who were feeling very similar to me knew that they weren't alone, and also that they felt that they had a voice even if they weren't able to question or challenge the care that they'd been receiving. I kind of wanted to be the voice for those people and to empower change to happen, because I think we can talk about all of the negatives and our bad experiences, but until we've got people who are ready to make a change, those bad experiences aren't going to change themselves.
For me, it's about let's raise the awareness. Let's kind of think, okay, you aren't alone. Personally, I think that's key, but if I can help to raise awareness of that, then that's all the better, really.
You know, I think that, as we were saying earlier, I believe that, you know, there are people in healthcare roles that are incredible, and I think, you know, at the heart of it, they want to help us, and if we can help them to help us by our, you know, negative experiences, then, you know, that would be fantastic. And, you know, one of the reasons I wanted to become a champion was because, as you said, I didn't want anybody who felt the same way as I did to feel in the same situation. I feel very privileged that I'm able to talk about my experiences. That stigma doesn't hold me back as much as it might do other people, so I want to speak for them as well.